So today we're going to be talking about inferior oblique myokymia, and normally it's superior oblique myokymia, but in this case we're going to be talking about inferior oblique. You can watch the superior oblique myokymia video if you'd like, and they're very similar. They're both monocular oscillations where only one eye is moving, and the patients typically describe it as shimmering or flickering. It's a very small amplitude movement with high frequency, and it's typically torsional, but they have both monocular and binocular complaints because they have binocular diplopia because of the misalignment produced both by the vertical change and the torsional change. So it's almost a telephone diagnosis. You hear this symptom, monocular, small amplitude, high frequency shimmering. The patients often describe it in a torsional movement. And with superior oblique myokymia, it's usually intorsional because the primary action of the superior oblique is in torsion, and it's usually worse when they look down. But in inferior oblique myokymia, it's an X-cyclotorsional movement, and it's going to be worse when they look up. You can do an MRI scan, but it's usually normal. The treatments are medical treatments: topical timolol, oral beta blocker like propranolol, or oral carbamazepine, although baclofen and gabapentin have also been used. And if you fail maximal medical therapy and the patient is having disruption of their activities of daily living, you can do surgery, either a superior oblique tenectomy or tenotomy plus inferior oblique myectomy, which is the same treatment surgically for superior oblique myokymia. And the idea is to cut both so that there'll be a balanced decrease in function, but you're cutting both muscles, so it really doesn't matter whether it's inferior oblique or superior oblique myokymia. The surgical treatment is kind of the same. And so you should know a little bit about both superior oblique myokymia, which is the more common version, and the rare version, inferior oblique myokymia.